Endocrine-disrupting chemicals are a wide class of environmental pollutants that include several pesticides, plastics, flame retardants, and toxic metals, often causing a very common liver condition. All of us know it as the non-alcoholic fatty liver disease. Now, this is increasingly getting diagnosed in the childhood years, affecting about 6% to 10% of the general pediatric population and approximately 34% of the children with obesity. Now, is there any relation between a prenatal exposure to the actual occurrence at childhood? Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about an exposure to prenatal chemicals causing non-alcoholic fatty liver disease in children. The growing incidence of a potentially cancer-causing liver disease in children is associated with prenatal exposure to several endocrine-disrupting chemicals. Now, this is the first comprehensive study to actually find out the association of prenatal exposure and mixtures of all these chemicals and non-alcoholic fatty liver disease. The researchers, they used the cytokeratin 18 as a novel marker for the disease in children, and these findings, as reported in the JAMA Network Open, they underline the importance of understanding how prenatal exposure to environmental chemicals can be a risk factor for the development of non-alcoholic fatty liver disease, which is a rapidly growing issue in children that can eventually lead to severe chronic liver disease and even liver cancer in adulthood. These findings show that early life exposure to many endocrine-disrupting chemicals is a potential risk factor for pediatric non-alcoholic fatty liver disease and must draw attention for additional investigations that might be needed to elucidate how the environmental chemical exposures may interact with genetic and lifestyle factors in the pathogenesis of the occurrence of any liver disease. So in this study, as I talk about it, the researchers measured 45 chemicals in the blood or the urine samples of close to 1,200 pregnant women. The chemicals, they included perfluoroalkyl substances, the organochlorine and the organophosphate pesticides, plasticiders, the polybrominated diphenyl ethers, and even the parabens. Now, when the children reached the ages of 6 to 11 years old, the scientists measured the levels of enzymes and the cytokeratin 18 as an indicator risk for liver disease in the children's blood, finding that elevated levels of those biomarkers in children who had been more highly exposed to environmental chemicals during the pregnancy period. So the authors then concluded that by understanding the environmental factors that usually accelerate a fatty liver disease, we can actually reduce people's risk by giving them additional actionable information that can eventually further reduce the risk or rather impact the occurrence of the disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.